A healthy gut microbiome is very important for disease prevention, metabolism, and digestion, and exercise can impact the bacteria that live in this microbiome. I'm going to walk you through how gut bacteria differs in people that have diabetes. I'm going to talk about how exercise can impact gut bacteria in most people, but not everybody. And I'm also going to discuss how exercise intensity plays a role. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. Our gut microbiome is an ecosystem that's found within our intestines and our stomach, and it's different within each of us. It contains trillions of tiny organisms like fungi, parasites, viruses, and thousands of different species of bacteria. It's heavily influenced by what we eat and drink, different medications that we take, and other health behaviors like smoking tobacco. A diet that's high in fiber, prebiotics, and probiotics, it's linked to healthier gut bacteria. And one of the ways that diabetes is related to the microbiome is through the role of the microbiome in its regulation of insulin sensitivity and also the metabolism of glucose and lipids like triglycerides, cholesterol, and fatty acids. People with type 2 diabetes tend to have a different microbiome composition than people without this condition. Specifically, people with diabetes tend to have lower levels of lactobacillus, which helps with digestion and it also promotes women's health. And they also tend to have higher levels of bifidobacterium, which also plays a role in digestion. There also tends to be a lower level of diversity in terms of gut bacteria in people with type 2 diabetes. It's really important to have a great amount of diversity in terms of the different species of bacteria in the gut, because this is going to enable the body to perform many of its different functions along with fighting disease. All right, I want to talk for a little bit about the study by Leo and colleagues that looked at exercise and the gut microbiome in people with type 2 diabetes. Exercise is very effective in trying to manage diabetes risk factors in most people, but some people might experience what's called exercise resistance or non-response. This is when the person isn't responding to exercise the way that they're expected to in terms of improving metabolic health, like improving glycemic control and improving insulin sensitivity. People can sometimes even respond to exercise in a negative way in terms of blood glucose and blood lipids like HDL cholesterol and triglycerides going in an unhelpful direction. And one study found that this happens in about 7% of people with prediabetes. Now, one of the reasons that people might be responding to exercise differently in terms of these cardiometabolic health risk factors is through differences in their gut microbiome. If you want to help support the channel, please hit subscribe and check out the merch link down in the description. The study that I mentioned earlier by Leo and colleagues, it was done in men with prediabetes who had BMIs over 25, so they were considered overweight. It was a high-intensity interval training exercise intervention that combined aerobic training or cardio with strength training. They met 3 times a week and each session was 70 minutes, and they were told not to make any changes to their diet throughout the 12 weeks. At the end of the intervention, the exercise group as a whole had lower body weight, lower body fat, better insulin sensitivity, better blood lipids, but when looked at individually, the participants responded to the intervention fairly differently in terms of glucose management and insulin sensitivity. About 30% of them were considered non-responders. There were 6 different bacteria species that changed in the exercise group as a whole after the intervention, and they belonged to the phyla Firmicutes, Bacteroidetes, and Proteobacteria. And there were some differences in how these bacteria changed between responders and non-responders. Before the intervention, non-responders had significantly different levels of 2 different gut bacteria, Bacteroides xylanosolvans and Bacteroides cellulosilicus. How the gut microbiome changed as a result of exercise, it influenced different diabetes risk factors. When looking at the exercise group as a whole, changes in 19 different bacteria species were linked to improvements in insulin sensitivity and glucose management. And changes in most of these species were different between responders and non-responders. So this is basically saying that in men with prediabetes, whether or not they respond to exercise in terms of improving insulin sensitivity and glucose management, it could depend on how their gut microbiome changes. And then other changes between the responders and the non-responders had to do with differences in how carbohydrates were broken down and also how amino acids were broken down. Exercise intensity is another factor to consider whenever we're thinking about how exercise can impact the gut microbiome. There was a study by Torquati and colleagues that compared moderate intensity exercise to high intensity interval training, and both of these conditions used a combination of aerobic exercise and strength training in people with type 2 diabetes. After 8 weeks of exercise, both groups experienced positive changes in gut bacteria, but it was different bacteria species that were mainly changed in each group. The high-intensity group tended to have positive changes in gut bacteria that were related to fighting off disease, and then the moderate-intensity group, they tended to have increases in gut bacteria that were more anti-inflammatory. Bifidobacterium and A. muciniphila. Exercise can help to improve diabetes risk factors, but these helpful changes may be related to each person's unique gut microbiome and the intensity of the exercise. If you plan on making any changes to your lifestyle, like taking probiotics, changing your diet, or exercise, make sure that you consult this with your doctor first. Thank you for watching.